Hi, I'm Dr. Rajani. Thanks for joining me on today's episode on SCARLET RF. I'm super excited to talk about it because it's truly revolutionary, and RF microneedling are the most sought after devices right now in the United States and around the world for one of many reasons. Particularly, people can wear masks after treatment a lot more easily than with laser resurfacing. They don't get as much acne. They're not very painful, so people are apt to come back and get more treatments. They're pretty quick to do, and especially with SCARLET, there's almost no downtime. Maybe a little redness for a short period of time, but of course, as you know, we talk about on this channel all the time, results are king. And I'm going to show you some before and afters of the SCARLET platform, show you how it's used. We're going to talk about the NA effect, so what separates it. And for all you home gamers out there, you're always asking me about the knockoffs or devices that you can get at home. Do they have enough energy? Are they safe? You'll want to watch this one because I'm going to go through a little bit of why the technology, the power, and the delivery really matters to get a result. And remember, you get one face. Don't mess with it. But watch this video before you do anything anyway, because it's going to help you. And of course, you know I love fillers, plasma sculpt, biostimulators, neuromodulators, and fat dissolving, all to create shapes. And this device came from Korea. I'm going to show you the Na effect. A lot of people are like, what's that? It's after Zhangju Na, who invented the device and the theory of it in the coagulation. But the before and afters we're going to go through are amazing. Stay tuned here. I want to show you how it works, and we'll get started. You know when. 3 seconds. So remember, like the video now, subscribe, most importantly, share it. How many people do you know don't know the possibilities of what they can do to maintain their skin, their youth, their glow? This is truly one that's going to help a lot of people because it's minimal downtime. Many people can do it, and it's non-surgical and non-injectable. So I want to dive in and show you, of course, what the tips look like. This is the SCARLET over here on your left. And here is another device that uses a different type of delivery. I'm going to talk to you why that's important, but here's the tip. Here are the needles. The nice thing about the SCARLET is once you get your tip, okay, the tip is often a consumable. It's yours, and you can do multiple pulses, so your provider can truly provide the treatments and the amount that you need to get the results. Look in here, the motor and the delivery, how the needles enter all at once, and the number needles we're going to talk about super quick. But the number needles are important because you don't want to have too many, and I'll demonstrate that. So here you can see there's a big deal about how the needles move smoothly with minimal bleeding and minimal pain. Those are two key important points. But look, when you look at the number needles in the delivery, look at comparable treatments. That's the skin. If you can see the redness in these areas, after SCARLET, it looks normal. Okay, now there is, when you do this treatment, there is a bit of redness, but you don't get the bleeding, and that's important because you actually get coagulation. The frequencies are all important. People talk about them when they're comparing devices. The SCARLET is 2 megahertz in frequency, and most others are around 1. There's a couple others that are around 2 now, but I think that's what really gives it a lot of its results. And the coagulation zone with that Na effect, which I'm going to explain, is very, very important because it's optimized to treat overall skin layers at a time. There's no overlapping zones, and that's key, so it reduces the risk of burns. What you're seeing here, these are insulated needles versus non-insulated, and that gives you that Na effect. And I want to dive into what that is because it's paramount to getting great results with this device versus others. The number of needles is important. The more you get, the more you can get a burn, surface problems. This is another device, and you can see there's 25 pins in the SCARLET, okay? And so that's an optimal number for its megahertz, okay? And for the amount of heat and power it produces, and for the motor. It all works together very precisely to give a good result. And that's the difference with getting cheaper or knockoff versions, is the skin's response, certainly downtime, but what I worry about here, side effects. and poor results. Now this is really important because we did talk about CO2 laser, watch my video on that, but that's vaporizing at about 100 degrees Celsius is vaporizing. If you look, that represents the red. This is the skin surface, okay? The epidermis and the dermis. So you can see what we're doing here. Now, here's your CO2 laser, and I'll clear the screen so you can see. If this is your skin surface here, you're ablating a good portion, and I showed you with the CO2 laser, you can stack them to get deeper, but you're still affecting the surface of the skin. There still will be some downtime. If you go to an insulated RF microneedle, which a lot of people are not proponents of, partly because look, you get a smaller zone deep in the dermis, okay, so it's deeper down. You're not going to get the textural changes that you might with a SCARLET. Look where the SCARLET's going. Let's clear the screen, I can show you. It is this shape is the Na effect, or Dr. Na, and he's an MD, PhD, very well studied, and it's this zone of treatment which is key to the SCARLET's result. It's a non-insulated tip like it is here. So this effect goes and it treats much larger surface area. You can look. At the same time, because you get a zone of coagulation, you get, look down here, the dark yellow is the protein denaturization. And as we talk about with everything, that's key to production of collagen. And what do we need? Elastin. That's what we lose as we get older, collagen and elastin. So we can affect more surface area, less bleeding, and we get a better long-term result, and people can do more treatments without having to worry about so much downtime. Here you can see that effect in the skin. The electrode goes in, the RF shoots, and you get that zone of coagulation, so you don't get a lot of blood coming to the surface for prolonged times, and that teardrop effect, and that's key for that Na effect. And of course, we went through the Korean V line, and Dr. Na knows very well about that Korean V line. The Koreans are very ahead in the world of overall aesthetics. Okay, and you know that a lot of our patients go from here to South Korea for surgeries for various reasons, but this device has those roots. Let's look at some results here. Of course, everyone wants a smooth forehead. You don't want to use toxin up here, okay, because what? It lowers the brow. But by doing RF microneedling with something like the SCARLET, you can get those results without having to do neuromodulators. I always talk about taking care of your skin, doing mesotherapy, doing RF in the forehead, and what? Retin-A's, okay? So your retinoic acids help smooth the forehead, all with, at the same time, avoiding having to do neuromodulators, which lower the brow. And everyone wants a raised brow, not a lowered brow. Now this is very common. What's everyone asking me all the time about? Pore size. Here's the before. Look at after. You can see a little bit of erythema left over, but the pores, fractionated RF microneedling is, I think, the best single treatment for pores. Everyone wants to do it by peels, by skincare. You can do it. They work with this. But if you want the single best treatment, fractionated RF is my go-to, like a treatment like the SCARLET. Here you go. Here's a before on the nose, and here's the after, and you can just see a lot of pore reduction. You cannot reduce or remove pores, but what do? You shrink them, because over the years they produce oils, and the RF fractionated microneedling works wonders for those. Now here is what everyone wants to see, and here's the before, and here's the after, and you can just see, this is 6 weeks after 3 treatments. The jawline was treated and the face. And you can see there's still some brown spots. They're not all gone, okay? You can do resurfacing with this, you can do peels with it, but an amazing result for something that can be used on all skin types with minimal downtime. Patients can go about their normal lives. Look at the fine lines here, and look at the fine lines here. And I want you to look at one thing overall, because we always talk about glass skin, Korean glass skin. Look at the glow. So if I remove the markings, just look which one looks younger. Do what? What do we always do? The quick Tinder test. That's the 3-second test. That's what people do when they see you. And you can see from doing that test with each face a lot of nice changes. If you look here, everyone after the face starts looking good, what do? They look at the neck. You can see an improvement in the face, but look at the neck region here. Tightening, brightening, a lot of changes in the sunspots. Again, they're not all gone. You have to have realistic expectations, but at this point you can still do lasers, IPL, you can do a CO2, you can add to it, but this degree of tightening with a couple of treatments with almost no downtime is very amazing. Of course, everyone wants to see the eye. This treatment can work well. Remember, it's RF, it's not laser. You can treat the under eye. Let's look at a before and after. Here you go. So if we look here, we can see, here's the before, and then look at the after here, okay? And you just see a tighter, brighter eye. And of course, what else can you do? PRF. So plasma eyes, and it works together. In fact, you can put PRF on top after you do a SCARLET, help with the healing. You can also inject it at the same time, and it works really well. Here, definitely a step towards glass skin. Look at the light reflection. You can put fillers all day long in this cheek. Great, but it's the light reflection, which is a little more anterior for a male, a little lateral for the female, high cheek. We go over cheeks in my video on celebrity cheeks, but have a little look and just look which one looks better. And you can see likely a little bit of melasma down here. You do not get the PIH that you do with lasers, CO2, and some chemical peels. You don't see that as much with the microneedling treatments. Let's look at another one. Here you go, here's a décolleté, of course the before and now the after, and just skin tightening through here, and less loose skin, more glow. Certainly the skin looks lighter and brighter. And again, she doesn't even need more treatments, but if you wanted to, you can add Sculptra, you can add PRF, you can do neuromodulators in the neck, all for better results. And where people want to stop, it's really hard to know, because when people look good, they want to look great. When they look great, they want to be rock star. So it doesn't end, and treatments can be added to this certainly, and the body seeing different types of treatments work synergistically. So there you go. Have you tried SCARLET? Have you had other RF microneedlings? What do you like? Are you up for a treatment like this, or are you more towards injectable treatments? The answer for most people is they just work together. So I love your comments. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.